Um, Good afternoon and welcome to Lunchtime Coaching. My name is Kevin Britz and I'm the owner of Business by Design, where we help people advance their personal peak performance in business and personal life. I'm an executive coach and licensee facilitator to Leadership Management International. Today's guest is a clinical psychologist currently working in private practice and as a consultant in the adolescent unit at Akeso Crescent Clinic in Randburg. Please welcome Christopher Kemp. Hello, Chris. How are you doing?
Good. Thanks, Kevin. Thanks for having me.
Thanks for being on Lunchtime Coaching with me today. So, Chris, the initial kickoff that I want to sort of share with people today is I did a small poll on LinkedIn recently, and one of the questions that I sort of posed was, what would you like more content about? And I put leadership there, I put team performance, I put mental health, and up to about 50% of the poll came back to say that mental health was a conversation that people wanted to have more about. So that's why, I'm so glad that you could make time for us. So just to kick it off, tell us more about who you are, what you do, and then we're going to go straight into some questions about mental health.
Sure, Kevin. So I think you summed it up pretty well. I'm a clinical psychologist working out of private practice. So private practice essentially means therapy, the sort of each person sits on a chair and talks to each other kind of stuff that I think most people would be accustomed to. But I am glad to hear that so many respondents mentioned mental health, because I think it's something that warrants more talking about. And I think a lot of people are kind of afraid to talk about it or afraid to bring it up. And I think the more that we can normalize that, the better.
So, Chris, I completely agree with you. And I think that's one of the reasons why I wanted to take this head on and sort of say, well, actually, let's have this conversation. So I'm going to kick it off. I'm sure everyone has their own version of what mental health is. But as a clinical psychologist, tell us, what is mental health? How do I detect, or what are the signs of having a mental disorder?
So I think something that I always encourage people to look for in very simple terms is that we always say that people are the expert in their own lives. And what we mean by that is that everyone has a baseline of their normal, of who they are when they feel like they're functioning, let's not say at 100%, but they're in a good space, emotionally, cognitively, they're doing their work, they're feeling good in their relationships. Everyone has that kind of space, that sort of baseline to work from. I always say to look for changes in that. If you don't feel like yourself, if you feel more emotional than normal, more anxious than normal, if you feel like you're just not quite where you feel like you normally are, or something feels different, or people are saying and asking you a lot if you're okay, anything like that, anything that represents a change could be something to keep an eye on. Hey, am I mentally in a great space right now?
Fantastic. So, I'm as a as a business owner and being part of the world right now, COVID has taken its wonderful place, smack bang center into all of our lives. One of the things that I think a lot of people are struggling with in business and personal is the whole COVID pandemic. So is that something you've also noticed, from your practice, how that's become a big rise in affecting how we do life and how, what our mental state is really about?
Absolutely. I think there's a lot of what we might call kind of secondary trauma that comes of something like this. So everyone's dealing with the fear and anxiety of the pandemic, but on top of that are the big stuff: financial implications, family members potentially getting ill. A lot of people have lost loved ones. And people are very scared for people in their family, especially parents and older people, things like that, or if you have immunocompromised family members. So I think there's a lot of anxiety and a lot of change. People generally don't like change. We have our routines, we have our structure, we know the way the world works, and we're sort of comfortable in that. And we all carve out a little piece of our own lives. And COVID has shaken up all of that. So our work isn't the same. Our jobs are threatened, or we're working from home, or we're trying to navigate Zoom, or, any number of things that just shake up our sort of comfortable sense of self. People in general just do not like change, and this represents a huge amount of it on top of all the anxiety, financial stresses, job stresses that comes with it. So I've certainly seen a lot of that, and I expect to see more as this goes on, more people kind of trickling in who've been affected, and that kind of buildup of anxiety and stress just becomes a little bit too much.
Yeah. And you use the term secondary trauma. I think and I sort of, when you use that term, it sort of lands smack bang in the middle of like, yes, I think that's a lot of what people are experiencing. Can you be in a position where you're going through secondary trauma and you don't really realize that you're in that trauma?
Absolutely. I think especially at a time like this, because the big stuff like financials, supporting families, that puts everyone in this mode where they feel like they just need to get through it, put their head down and get through it. And I think a lot of people felt that way in South Africa, especially. We had the lockdown and everyone thought, okay, 2 weeks, we got this. We're in this together. And everyone was so not excited, but motivated, and everyone was in a good space about that. And then the longer it's dragged on and the more this has been a thing that we realize is going to affect ourselves in years to come, I think the more anxiety that creates. So people are so focused on the sort of immediate demands of the environment, and mental health always takes a back seat. I can't afford to not be okay right now. I need to go to my job. I need to make money. I need to support my family. I need to be okay, even when they're not okay, but they feel forced by the environment to be okay. And that creates very, very difficult situations where people are unfortunately suppressing a lot of what they're going through. And you're going to have the crash on the other side. When you finally get space to breathe, all of that comes out, and it's big and overwhelming because it just hasn't been dealt with.
Chris, also, I mean, it's not part of my list of questions here, but as you're speaking, it's just coming to mind that, do you think it's normal, and I use the word really loosely when I say this, it's normal to be going through kind of some kind of mental challenge currently, quite specifically because of COVID, but is it normal for people to really just be going, wow, I don't have the answers, I need to speak to someone? Because I think a lot of people, they, like you're saying, they just have to get through their day. They have to, they've got to make it happen. They've got to get their business out there. And yet they're actually going through a bit of trauma when they don't realize. And can we say that it's okay and it's normal for me to feel shitty about it right now?
Absolutely. So I'm glad you brought that up, because that's sort of what I was alluding to when I said more people need to speak about mental health at the beginning. The big push there is to normalize it, to say that everyone's going through this. Everyone is actually struggling. And the more we talk about it, the more we normalize it, and people feel okay to say, yeah, you know what, I'm not in a good space and I'm struggling. And I think that's the big push, because there's something about mental health and sort of the stigma, and there's this sort of fallacy around it that we can simply control it, that we can simply say, pull yourself towards yourself, stiff upper lip, whatever the case may be, and get on with it. And it's just not the truth. Everyone has feelings. Some people are better at hiding it than others, but nobody is able to truly just push it aside. So absolutely, normalizing is goal number one, I think.
And I think would it also be fair to assume then, if normalizing it like that would be, and I'm feeling really bad in that day, to be able to go, and I know, that there's the assumption that men don't really speak about their emotions a lot, which may not necessarily be true, but I'm just going on generalized assumption. As that business owner, feeling that feeling of like disappointment or sadness, or that in itself can trigger a lot of other problems in your life, right? So, holding on to that negative emotion or that feeling that I really don't want to speak about, that in itself can trigger signs of depression and anxiety. Is it fair to make that assumption on that's why it's important to speak about it?
Absolutely. I always say you can't control your feelings. You can control your actions, but you can't control your feelings. So the important thing is to suppress that. Sure, when you're in a Zoom meeting or you are working with staff or whatever the case may be, in those moments, maybe you need to just sort of hide all of that and do the things you need to do. But it's important to then make space later on where you are actually giving yourself the space to process what you're feeling. Suppressing emotions is absolutely what leads to depression and anxiety down the line, because they will always find a way out. I always say emotions demand to be heard. They will find a way out. And if we don't do it in a healthy manner, they'll find an unhealthy manner to express themselves.
So in terms of many times mental health is referred to as a psychological problem. Is that a correct statement?
I think it's a correct statement. I just hope that doesn't come with a sort of negative connotation attached to it. I think absolutely there's a psychological problem. I think we start to think of padded walls and straitjackets, but I think that's all feeds into that thing where if someone says they're ill, physically ill, no one bats an eyelid. But when we're feeling emotionally unwell, it's sort of this, like I said, this fallacy that you can kind of just get over that. And I think what I really want to push for is that we treat it the same way. So often people are calling into work saying that they have the flu when really they just feel like they can't get out of bed that morning. And I would love for it to be normal and okay for people to say, hey, Mr. Boss, I'm actually having a mental health day today. I'm not in a good space and I need a day for me. And for that to be acceptable. And the fact that it's not is, I think, a huge part of the problem.
So on that note, what are some of those things that I can start paying attention to? I'm not feeling great. I'm having an emotional day. What are those signs that I should start paying attention to when something feels out of whack for me?
So again, for me, the big thing is changes, right? A lot of, even when you're talking about depression symptoms and things like that, a lot of it deals with changes. Has your sleep changed? Has your appetite changed? Are you feeling a little bit more different than normal? One of the big ones is, are you not really enjoying things that you used to enjoy? That's kind of a big one. So when you do have your time out where you doing your hobbies or spending time with family or whatever it is that you normally enjoy, if you feel like it's not really hitting home, it's just you feel a bit empty, that's a big one to look out for. That's, hey, maybe you're not okay. And like you said, this will affect multiple parts of your life, and emotions will come out in other ways. If you find that you're snapping at your wife, or you're impatient with your kids, or whatever the case may be, then it's sort of a sign of, okay, there's something not right here. I'm normally this easy, laid back guy, and now I'm grumpy and irritable and frustrated all the time and not patient. There you go. There's a big change in your personality, and that should be an indicator to you to do sort of like a mental check, like, hey, am I okay right now?
So in terms of the diagnosis process, so the current system that we have around mental health is diagnosing and treating mental disorders. How should I think about that? Because when I had family members that really went through a lot of depression, and from the outside, I looked in and thought, wow, they had to go on medication, and it affected them in so many ways, their hormones. And so for me, when I went through being diagnosed with clinical depression way back when, I kind of freaked out, and I went, I don't want to be that. I don't want to do that. And how do we as a species, because I suppose it's it's quite a big topic, and it affects human beings really. And how do I get my brain wrapped around when I might be diagnosed with anxiety or with depression? How do I do that?
So, something I often say is I feel like the labels are much less important than your experience. So people always come to my practice and they say, I'm depressed or I'm bipolar. And I say, cool, what does that mean? That doesn't really tell me anything about you. It gives me a really brief summary of what you're going through, but it doesn't tell me about your personal experience or what you're kind of going through. So I think that certainly antidepressants are helpful. I'm definitely not opposed to them. I recommend them often. And I think you can absolutely go and chat to a psychologist, and they might recommend, hey, I think you maybe need to look at this. We often call it kind of like scaffolding, just a little bit of internal support. I don't think antidepressants in particular, I wouldn't want people to be super afraid of them. They're not huge life-changing drugs with awful side effects and things like that. The sort of standard SSRI stuff that your doctor or GP would even put you on are unlikely to really affect you very negatively. I always compare antidepressants to sort of like prescription glasses. So if I don't have a vision problem and I put on glasses, I don't now see super well. It just makes me see as I should see. So I think a lot of people worry about medication in terms of, am I going to be a zombie? Am I going to be unable to feel sadness? And I always use that glasses comparison. It will make you feel as you should feel. It'll get you back to your normal baseline level. That's what antidepressants done well are supposed to do. So don't be afraid that it's going to change your personality or change who you are. Who you are when you're struggling with real depression is not who you are. That's not you. The antidepressants are to try and get you back to you and your regular baseline.
Chris, so if I'm taking an antidepressant, for example, and I've been diagnosed with, is there a way for me to get to a point where I don't need antidepressants and I'm fully functional and I can go, cool, I'm taking care of these things in my world and I'm starting to adjust my life accordingly? Is it a case of saying I actually don't need antidepressants? I can actually do a lot of adjusting, or do we just go, okay, cool, I'm depressed, I need antidepressants?
No, you're absolutely correct. Sometimes there's stuff going on in your life, or you're going through a particularly bad time and you just need that extra support. But absolutely, if you feel like things are going okay, you can come off of them. It's certainly not a life sentence. Normally what they do is they sort of step you down a little bit. So antidepressants are not addictive. You don't develop any physical addiction to them, but if you stop taking them suddenly, it can cause some weird side effects. So they will kind of wean you off them. But I wouldn't want that to freak people out and feel like it's an addiction. It's not. So once you have weaned them off or whatever, you're not going to be itching for an antidepressant a month down the line or anything like that. So absolutely the goal is to get you off them if you don't need them anymore. And they come in a variety of dosages. So a lot of them, you can really step up and step down dosages very easily.
Okay, so in terms of, given that mental disorders are diagnosed by virtue of their symptoms, rather than a basis of underlying causes, is that current treatment truly effective?
In terms of medication as treatment?
Yeah.
I think that it's different for everyone. I often say antidepressants are not a silver bullet that just fixes everything. A lot of times people may benefit from a therapy process. They may benefit from antidepressants, one or the other, or both in a lot of occasions. So a lot of times if people just are having a rough time and they just need to get those feelings out, they need to unpack what they're feeling and make sense of what they're feeling, that's where something like therapy can be really beneficial. And I don't think everyone immediately needs to run for medication. Absolutely not. So I think it very much depends on a case-by-case basis. And that's why it's good to chat to someone who can kind of evaluate and say, okay, look, I'm a little bit worried about you. I think you may benefit from this, or, let's chat and see how you're feeling.
So in terms of the designated helpers out there, what are the differences among them? Because you get psychologists, clinical psychologists, you get counselors, you get practitioners, the coaches. What are the differences, and how do I know I'm going to the right person, kind of thing?
Sure. No, I think that's a good question, and I think it can be a little bit intimidating. So if you go and see a psychologist such as myself in private practice, basically you would be going 9 times out of 10 for a therapy process where we're going to sit and unpack and try and make sense of what you're going through and figure out where it's coming from and what sort of help you need. A psychologist may then refer you to a medical professional like a doctor or a psychiatrist if they want to do medication. So psychologists don't prescribe medication. We do the therapy part. The doctors do the sort of medical stuff in the medication and the physiological effects of that, and et cetera, et cetera. So oftentimes that referral basis happens, and vice versa. Oftentimes a psychiatrist or doctor would refer you to a psychologist as well. So clinical psychologist is more in terms of like our scope of practice includes like more serious, I guess you could say, mental health stuff, mental illness stuff, things like that. Whereas a counselor, for example, that's someone you would go to where you're having a difficult time at work, or you're feeling like you're not happy and you just need to talk to someone about it and talk through some things. So certainly a psychologist can do that as well. The scope is just a little bit larger in terms of dealing with more clinical illness. So for example, you said at the beginning, I work at a clinic, and that's an inpatient clinic as well. So people will be admitted there because they're seriously struggling. So that's somewhere where like a clinical psychologist work, where maybe a counselor wouldn't be able to work in a setting like that.
Yeah. So part of understanding that underlying causes could be part of the actual problem that I'm sort of experiencing with whatever mental disorder I may have or may be suffering with. Would it be fair to assume that you really need to get to the root cause of of what's causing the discomfort or the disorder? And is that possible? Is it possible to sort of go, okay, cool, this is the thing that I'm really struggling with, and if I start fixing that and how I language that for myself on a day-to-day basis, can that take away the actual symptoms and really get me to be different and behave different and feel different?
Absolutely, yeah. And I think everyone's therapy process in that sense is different. Sometimes people come with something very specific that's happening and you can kind of resolve it and they see you 2 or 3 times and then it's done. And some people you'll see for a very long period of time, and they've had some very difficult stuff that's happened throughout their lives, maybe even in their childhood, going that far back. And there's a lot there to sort of unpack and make sense of in terms of how that affects you as a person today. So you might feel anxious or insecure at work, and it might partly be because of an environment in which you were raised or experiences in your life that sort of contributed to that. So things can be simple, things can be complex, and I think everyone's process is different in terms of what they would like to get out of it. Some people would like to engage in a more long-term therapy process and unpack a lot of their feelings and make sense of themselves. And some people are just coming to you and saying, hey, look, I'm having this problem at work. I need some help. What do I do? Kind of thing. And that's fine as well. So I think everyone's process is different. And I think that a good psychologist will work with you in terms of what you need rather than forcing their way of doing things on you.
Okay, so I'm going to pose a scenario. So what if my formed personality and the identity that I have on the planet is partly causing the emotional pain? How do I wrap my brain? Because to give you a simple example, someone who might be in a corporate setting, they really, part of their identity is that they a bit of a bully maybe, and but for them something's really feeding from that. How do I sort of wrap my brain around and kind of go, okay, cool, although it's even part of my personality, how am I going to shift that? Because I know that specifically when dealing with corporate and executive coaching, a lot of the time that's what I deal with, where people are struggling with their formed personality, and yet it becomes part of the very pain or the very thing that they're trying to change. How do we get around that?
So generally the first step with something like that is insights. Are they aware of how other people perceive them? Are they aware that they are perceived as a bully, for example? And helping them to sort of understand the impact that they have on other people. Everyone's the hero of their own story, so it can be hard sometimes to recognize how other people are perceiving you. And so it can be helpful to sort of shift that focus to the other side and say, these are your intentions, but how are you being experienced by other people? Because oftentimes those things don't line up. My intention might be to be supportive and you feel like I'm being critical, for example. So there's a huge mismatch there. And then from there, we can sort of try and make sense of where that comes from. If, like you said, it's part of their formed personality, where does that bullying tendency come from? Is it an insecurity that sits inside of them? Do they feel like people don't take them seriously, so they have to present this alpha sort of personality in order to be acknowledged or recognized? There's so many different potential avenues you could go down there, and it's about making sense of that person's individual experiencing and understanding why are they acting this way in the present? What's contributing towards this, and to help them make them aware of that, so then hopefully they can sort of alter the way that they do things or not feel like they need to present in that way. So, for example, if your goal is to be recognized or respected or acknowledged, we can try and, come up with healthier ways of doing that.
So in terms of how should I get my I have so many questions for you. We could be here for a couple of hours, but because coaching, we only have 30 minutes, and we want to sort of give people as much value as possible for this 30 minutes. So in terms of good mental health, what am I actually aiming for? What is that thing that I'm sort of going, okay, cool, I'm getting there. I'm actually starting to feel better. What am I reaching for?
So I think it's sort of different for everyone in the sense that everyone has different goals or things that they're concerned about. So for some people, it might be their relationships. Maybe they're struggling in their family relationships, or they're struggling to relate to their wife or their kids, or whatever the case may be. And that may be where they're struggling, and that's where they want to work towards, or they're not performing well at work. I think that it's cliched, but I think if you feel happy and content, you are most likely in a good mental health space. And I think to sort of package that, I would also want to say that it doesn't mean that everything has to be good all the time. A normal human experience is to have good days and bad days. So oftentimes when people are diagnosed with depression, for example, they have a bad day and they go, is this my depression? And I always want to say to people, remember that being sad is part of the normal and necessary human experience. So it's important not to demonize negative feelings. Negative feelings are normal. It's how we process them and work through them that's healthy. So I think as long as you feel in your life satisfied, content, happy, you feel well in your relationships, you feel good about your work, I think you're probably in a good mental space.
Fantastic. Chris, so lastly, if you could leave us with 5 practical things we could do today to kind of check if we are feeling really bad, or we're sitting in a position where I don't know, there's mental health is such a broad topic, but if I can take 5 practical things about today's session away from today, what would that be, and what can I how can I take action on it right now?
Great, thanks, Kevin. So I made a list of these 5 that I think are kind of the big ones that I would say. So the first one I have here is to make space for yourself and your feelings. No matter how pressured you feel, no matter how hectic the demands of work and family are, it is so important that you are making some time for yourself, whatever that may be. If you need to sit outside and have a beer for 30 minutes every day, or whatever the case may be, you need that time for yourself to process what you're feeling and making space for your feelings. Again, it's the buildup of suppressed feelings that will really get you in the long run. So just make sure that you are making space for yourself, whatever that may look like for you. If it's watching some TV at night and just relaxing, or going for a walk, or whatever the case may be, you need to carve out some time that's just for you, and make sure you have that thing to look forward to, and that's your kind of reward. Can't be go all the time. The next one I had is sort of to break things down into actionable goals. I think this is quite a common tip, but oftentimes with work and stress, everything feels like one huge thing, and then it becomes incredibly overwhelming, to the point where anxiety is sort of stimulating and motivating when you feel like, oh, we've got a deadline tomorrow, I need to work. When it becomes too big, it swings to the opposite, where it becomes debilitating. When it becomes so big that you're like, I can't face this, I can't deal with this, and you become paralyzed, and then you don't do anything. And then, of course, it gets much worse because that thing only grows and gets bigger. So if you're feeling that way, that is this huge thing, break it down into an actionable set of goals, make a list, tick them off, something to make you feel like it's not one huge thing, but a series of small things that you can tackle. Okay, the next thing is for those working from home, which I think there's a lot of you. I think it's so important to develop a routine for yourself. So I mentioned earlier that there's so much change in terms of how your day-to-day looks. I think it's really easy when you're working from home to sort of wake up and watch some Netflix and like roll out of bed and, do Zoom in your pajamas. And you sort of get into this unhealthy space where you don't really feel like you. So try and create some routine and structure that you stick to every day. You wake up at this time, you shower, you get dressed, you do what you need to do for the day. That will help things to feel a little bit more normal and a little bit more predictable. Otherwise, it can be quite demotivating and debilitating when you sort of are, I've got a meeting at 10, so I guess I'll get up then and I'll do my other work at this time. Some people love that, and that's great. But if you're not one of those people, develop a structure and routine that makes your life feel a little bit more normal and predictable in these very uncertain times. Okay, next one is, I call this being congruent. So in psychological terms, what congruent means is that your external representation matches your internal feeling. So what I mean by that is, what I often say to people is that if you act like you're okay, people treat you like you're okay, which can be a big problem because you are really, really struggling, but you're putting on this brave face and everyone's making normal expectations and normal demands of you, not knowing how much you're going through, which can be really damaging to you because you feel like, I can't cope. Why they asked me this? And make sure that you let people know. Don't be afraid to lean on other people. Don't be afraid to say, hey, I'm not doing okay at the moment. Do you mind scaling back a bit? Or like, I need to get through this and then I can look at that, whatever the case may be. But don't act like you're okay. Otherwise, people will treat you like you are. And that's not what you need. So put those own needs first. Okay, and I think the last one, I think we're on number 5, is just to do, we spoke about this, but just do mental self-checks. Just try, it's so easy. You'd be surprised how easy it is to simply think that you're fine when you're not. And I've been victim of this as well. So it can certainly happen to anyone where you just are going through and you're not really thinking about yourself or how you're doing. If anything triggers that little like, that was a bit of a weird response from me, or like, oh, that's not quite me, take some time and think, how am I actually doing? Am I coping? Do I need help here? Just make that space to sort of do a mental self-check, and just make sure that for yourself that you're doing okay. You know yourself better than anyone, better than any psychologist, any doctor. You know you the best. That's why we always lean on you for your expertise on yourself. Even as psychologists, we say you're the expert in your own lives. You tell us how you're doing. So, I think absolutely make sure you're doing those self-checks.
Fantastic, Chris. Thank you. I think those are so relevant for today, specifically in a personal setting, but also in a business setting. And I'm such a true believer of congruency. It's part of what we teach in training and NLP. So the congruency of how you're communicating that and getting your brain on board with that, but also having understanding your state and the feeling that you're feeling in the moment, and having more awareness of that, because the more aware I am of it, the more I have indication of how I'm doing. So I think everything you're sharing is so fantastic, and we have literally run out of time. So Chris, if
good timing.
Tell us where we can get a hold of you, and how can we sort of have a chat if someone wants to chat to you.
Sure, thanks, Kevin. So my name's Chris Kemp. You can find me on our webpage for the practice, which is cccpsychology.co.za. So it's just the letter C twice and then psychology.co.za. You'll find me there under Chris Kemp. You can also email me if you want. It's chrisk@cccpsychology.co.za.
Fantastic. And all of that information will be in the description box below. This will also be loaded to YouTube and go out to various social media platforms, but also in association with South African Depression and Anxiety Group, SADAG. That's where I got hold of Chris, and they've been so kind to support us. Guys, if you really want to also speak to someone, that's also a wonderful place to go. It's sadag.org, sadag.org. And I'm just going to leave us with a nice quote to end off today's mental health chat. One day, or day one, you decide. Chris, thank you so much, and thanks for being on Lunchtime Coaching. Hopefully I'll see you next week. We'll chat about it. Thank you.
Yeah, perfect. Thanks for having me, Kevin.
Chat to you soon. Cheers.
Cheers, Bye-bye.
We're